Sure, my name's Mark Zimmerman. I'm formerly with the US CDC for about 20 years, worked with them, and much of that time in Southeast Asia. After that, I retired in 2010 and I moved on to work in private industry. I worked for a vaccines company for about 6 years. And following that, more recently, I've joined with SEAOHUN to be the executive director for the regional secretariat for our program. SEAOHUN is a regional network of universities in 4 countries in Southeast Asia. It includes Thailand and Malaysia, Vietnam and Indonesia right now. We're looking at the possibility of expanding the network as well to include some of the other countries in the region. And basically it's a collection of new universities, as I said, both public health universities, human health universities, and veterinary or animal health schools that collaborate to produce curriculum and training to improve the ability of our workforce in the region to respond to zoonotic diseases. Zoonotic diseases are diseases that come from animals, particularly both wild animals, contact with wildlife, and also in particular with domesticated animals, animals that we grow for food.
Freaky boys jamming.
The biggest success to date for SEAOHUN is really the strength of its partners and the relationships that we have with the universities and with the individual professors and students and other partners and collaborators in all these different countries who share a common value, they share common goals. We're all working to improve our human health and animal health and also the health of our environment. So with the strength of that shared value and all of the resources that these universities bring to bear and also the expertise of our individual members, I think we're really unique, that there's really nothing quite like SEAOHUN in the region. Actually, right now we're looking at a number of different possibilities. We're considering, as I mentioned, the possibility of adding additional countries, additional universities to our network. But we would also we're looking into the future in terms of what are the roles that we can fulfill with the expertise, the relationships, the networks that we've already built. Are there other areas that we can expand to, specifically like perhaps a research consortium, where we work cooperatively on One Health-oriented research into zoonotic diseases and infectious diseases that pose threats to the entire world, not just to an individual, but to the entire world. So that's one possibility. The other possibilities that we're looking at may be different models of education and training that would involve long-term training for and awarding graduate degrees, for example, to students who want to learn about animal and human health in a One Health context. Well, I would say that my vision for the future of our network is a network that's robust, that is transparent, that has active communication and collaboration at all levels, that really is unified behind our common interests and sees that everything we do is for the best interests of our people and for our environment and for the animals that we raise. And so I think that that's really the ultimate goal in my personal perspective, is to help our entire network move in that direction and become the best and most capable network it can be.